just by a show of hands, how many folks out there are in the healthcare profession? That's what I thought. Fair amount. And just kind of talking to a couple of you during the breaks and during lunch, I kind of noticed that. So we're all kind of in the same boat when it comes to healthcare. A couple of takeaways I had from the earlier speakers and a couple of things that go in line with our policies at Metro, prevention and education. We have to establish policies so that our staff can really be prepared to educate patients and fellow coworkers. And we truly are a partner with agencies like Tom's. We're truly a partner to try to get resources and kind of think of that as Metro as your partner in establishing the communication to the patients. So I have to start with the mission statement because that's where a lot of these speeches start. MetroHealth, we're committed to the needs of our community, improving health status within that community, and obviously lowering costs. We hold as our core value the provision to provide services for residents of Cuyahoga County, regardless of their ability to pay. So truly, as you can see, our mission is with the community itself. A little bit about MetroHealth. Been in business for a long time. Similar to our competitors, our main campus is downtown on West 25th Street. We have 16 different satellites throughout Cuyahoga County. A lot of folks don't know that. Spread throughout Westlake, Beechwood, Broadview, and a brand new facility going up right down the street in Middleburg Heights. So we're glad to be a part of this community as well. In fact, after this presentation, I was told to make sure that everything was going well down the street. Sorry, my presentation and my bed bugs were not as good as the other presenters, but our agenda here, and really my colleague Bob has been in the industry for quite some time, and he'll be able to kind of tell you the nuts and bolts of how we combat and prevent some of the incidents that we do have. So I want to kind of start off with a patient story. You could really plug in different names and whatnot. There's probably some folks here that can definitely relate to the story that I'm going to communicate to you. I want to go over our policy because truly it really starts with the policy that everybody can kind of navigate through and understand how to handle different situations. Third thing I want to talk about is definitions. I think we have a real clear definition on exactly what the bed bug looks like and the characteristics, but I want to kind of go over Metro's spin on that. And then Bob's going to talk about, like I said, the environmental services. We have total, we have 6,000 MetroHealth employees throughout the county, and a good portion of those work for environmental services department. And these are the folks that are the frontline people that work with the patients and staff. I also want to talk about inspection procedures as it relates to healthcare industries, extermination procedures, and then once something is identified, we want the patient to be educated, and a couple of things that we're doing that as well. I think another takeaway I'm going to take from this presentation are the resources that were presented to everybody and get ourselves updated on how we can kind of communicate those resources to the folks out there, and then we'll conclude. Sorry for the eye charts here, but like I said, it's a pretty common story. I asked our clinicians on, maybe we can tell a brief story on what they see from time to time. And of course, we have to keep everything confidential, as you well know. So a patient comes in and presents a rash for about 3 weeks. It's something that's been persistent for a while. After the 3 weeks, they had accompanying chills, fatigue, headaches for the past week or so. Patient was noted to have multiple red marks scattered on arms, forearms, and throughout the body. So what are you thinking if you're not educated with bed bugs? You're thinking, let's get down to the hospital and find out what this is, especially the fact that it's been going on for a couple of weeks. So again, education. Had that person been educated, maybe they didn't have to make the trip down to the hospital to only find out what it was. So this is kind of a common scenario. The patient's son did not have a rash. Patient then had a full lab workup. So we've all been there where we wait in line, we do our copay, we have different tests being done just to find out exactly what this situation is. After that, the test came back. Looks like there's 2 lesions consistent with hypersensitivity reaction. And at that point, the patient had an exterminator returned back to the residence. They found numerous bed bugs on the couch this time, and the patient did say that they sleep on the couch exclusively. So there's a good trail on to find out what the source was. The good news is the patient was treated, and they got rid of the couch, and they no longer lived in that apartment. They moved out, and to the date of this, there was no further reaction or whatnot. So again, that is a good story to relate to, where they had symptoms, they went to seek medical care. Based on diagnosis and testing, they decided that it was bed bugs and reacted accordingly. So the way that we treat, if you would go onto our computer site at Metro, you can actually, we have hundreds of different policies, and we have a policy that addresses bed bugs. And that policy states that MetroHealth System is committed to immediately respond to the threat or presence of bed bugs. So we are proactive, and that is our clinical staff is proactive, our facility folks are proactive, and Bob will talk a little bit more in detail on that, and of course our environmental services. So it's all about education, and as I stated before, it really starts with that policy right there. The purpose of the policy, as I stated, to provide employees and patients with information to assist in identification of bed bugs, procedures for the appropriate action to protect patients, staff, and environment when infantation is occurred, and the procedures for the containment and extermination of bed bugs. So there it is, spelled out clear as day on how to react to a case like that. I think we kind of went over this before. I think we know what the indications of a bed bug is. I now am a little bit more of an expert on bed bugs. I will tell you this, that my experience was somewhat minimal prior to this homework assignment, as I call it. Common bed bugs, and I'll leave it up to the doctors and the experts to pronounce it properly, but it is an insect that feeds on human blood, and I do reiterate that it is a pest, okay? It doesn't transmit anything, and that's what we try to educate the patients and staff, that it is a pest, and it's really about education and trying to prevent the spread of that. A couple of characteristics, as we talked about, to help identify that, it is very small, reddish brown in color, does not fly. Okay, that's another good characteristic. So we do have some false calls on, well, we see a bug. Okay, is it a bed bug? So a couple of things that you can kind of look for characteristic-wise to quickly identify if it is a situation that we have to react or not. And a lot of the other speakers talked about that as well. Newly hatched bugs are white and yellowish in color. Bed bugs are generally not carried on a person, and they do not transmit disease. Their bites are typically painless, and that does happen typically at night. That is my part of the discussion. I'm going to turn it over to Bob, and he'll talk about the environmental service part. Thank you.
Hello, everyone. As stated before, I've been in environmental services for like 31 years. And probably within the last 10 years is when we started seeing, probably 12 years, anything to do with bed bugs. So a lot of learning had to take place, both with myself, with staff that I worked with nursing staff, and even the physicians. As the state services, whenever they identify one, and it's not even identifying it, I would get a phone call, or one of the supervisors would get a phone call and say, we got bed bugs. First question is, do you have a sample of the bed bug? No, but they got bites all over them. I says, okay, treat it as the person has bed bugs. If you find a sample, let me know. I'll come and check it out. Have our exterminator check it out. The policy states that we contact the facility management department to inspect the cracks. We're proactive in that. Since I've been at this location, we have tried to maintain all of the breaches in the flooring, the walls. Wallpapers came down, paint is replaced it. So we are proactive on this a lot, not only in emergency rooms, but off-site physicians' offices, waiting rooms, the types of furniture that we're buying. We're trying to steer away from the cloth furniture. So when we are notified, if they have a sample, we'll go down, we'll check it out. If it is a bed bug, then we have certain protocols that we have to follow. Everything that goes into the room stays in the room, or stays in the room. Any type of equipment, it doesn't matter what it is. We do not bring the equipment out once they start working with the patient. I immediately, or somebody immediately calls the exterminating company. The exterminating company's policy states will inspect the room, treat the room in 24 hours. We now have it where we have the company coming in twice a day, early in the morning and then late afternoon, just to see if we have anything. Any off time hours past 6:30 p.m. If there is a definite bed bug situation, we will contact them, and within 3 hours they will be out to inspect the areas and do the procedure if need be. After 6 hours of treatment being applied, myself or one of the supervisors or one of our lead employees will go into the room, inspect the room, see if there's anything else in there. Then, if not, then the room gets cleaned. So within 6.5, 7 hours after the room is treated, it's ready for occupancy. All the linens in the room, including any window coverings, privacy curtains, all of that is removed, is taken directly down to the laundry department. It is marked, and I think it's in the next slide here. All the trash is taken to a special area, and we autoclave the trash before it goes out. To protect our staff and other patients, the staff will put on a tie-back suit. When they leave that room, before they walk into the hallways, the suit is taken off, put into a bag. When the patient is brought into the emergency room or doctor's office, they say they have bed bugs or a bed bug is cited, the clothes come off, the clothes go into a trash liner. The trash liner is sealed. If need be, they try to decontam the patient because there are instances where the bed bugs were climbing in through their hair and could actually see them on their body. We have patients that come into the facility that first words that come out of their mouth whenever they sit down at the registration is, "I have bed bugs." So immediately the protocol goes into effect. Any clothes, if they come in with somebody, any clothes that belong to the patient, we give them to the person that came in with them, and ask them to take them out of the facility. We give them scrubs or whatever type of garments we have, and they can go home with it. Any of their cell phones, whatever, anything they bring with them, we try to not let it go outside of the room. Cell phones, we ask them to put those in bags. We just don't want any means of transmitting these the bed bugs to somebody else. I already spoke on the linen. Again, they decontam the patients, shower if possible. And these are just some of the things that they do, inspect the skin. When the patient leaves a room that has the bed bugs, until the exterminating company gets there, the room is sealed off, towels or tape put at the bottoms of the doors, just because the bed bugs like to travel. So we're not taking any chances with this, them going into another room. After the room has been exterminated when claimed, IV poles, eye bags, any type of equipment that is in that room is totally torn apart and cleaned to make sure there is no possibility of eggs or bed bugs in those little tiny crevices. Cleveland Health Department has received about 500 complaints of bed bugs this year, compared with the 390 this time last year, so it's a large increase. And Health Department, 1,000 calls so far this year compared to all of last year, 1,100. So again, a large increase in bed bugs being spread around. Whenever we get a lot of phone calls about bed bugs, and as some have stated earlier, not everything are bed bugs. It's the first thing, anytime you see a bug, a mark, it's because the bed bug is out there, everybody thinks it's a bed bug. Probably, I hate to say this, probably 45% of the calls that we get are actually bed bugs. The rest aren't. Could be fleas, could be any type of insect, but we try to stay proactive. We don't want you or your family coming in to our facility and going out